Hello everyone, welcome back to Drug Today Medical Times. Today's episode is going to be a bit different, but incredibly important. We are diving deep into the world of infertility, something that affects so many lives. We had the privilege of chatting with Professor Dr. Human Fatemi, and he shared some eye-opening insights on lifestyle, health, and reproductive wellness. But do we truly grasp the bigger picture, the global landscape of this issue that impacts so many lives? Picture this. Infertility isn't just a topic confined to one corner of the world, it's a global concern. And here's the kicker, it's not as straightforward as we might think. It's like trying to solve a puzzle with pieces scattered all over the world, each piece unique to its own place, culture, and lifestyle. But before we begin, we would like to request that you visit our website, www.drugtodayonline.com, for evidence-based information on health across the globe.
And the question is, what about the rate of infertility worldwide? I think it's a difficult question to answer because worldwide you are dealing with different ethnicities, you are dealing with different geographies, different lifestyles, different cultures. Globally, the WHO speaks around 15%, but I think this is not what can be said about the region that we are here. So most probably the prevalence is around 15 to 20% in the region. In some regions it might be even more. But what we see is that the etiology, the cause of infertility, is already dealing with this. For example, Japan, Denmark, China started having a decline. So we see countries which start facing. India is still going up, but the anticipation at some point also is India that it would start declining and the infertility would increase. Hence it's important to anticipate, and also information of patients to prevent it is extremely important.
Professor Fatemi is going to help us understand how the way we live nowadays could be linked to some of the challenges people face when trying to have a baby.
It is very important to understand why this is happening. Change of lifestyle, yes. Simply, you need to expose 20% of your surface of the body, let's say in the morning, 9 o'clock, 10 o'clock, to the sun. Why 9 o'clock, 10 o'clock in the morning? Because this is the time where you have UVB exposure. And UVB exposure is important for example, creating what we call 1,25-dihydroxyvitamin D. So, changing lifestyle important. Moving is important, obesity is not good, sun exposure is good. All these factors at the end play a role for maintaining a good quality of eggs.
There's this common belief floating around that male infertility is more prevalent than female infertility.
No, absolutely more female. I know in the media people jump on it and they say the male infertility is on rise, the sperm quality is declining, and especially media jump on it and it comes to the news. But I can assure you this is not the truth. Even if you see a decline of the sperm quality and so on, you see we don't know what is a normal sperm quality. People say maybe 16 million, if you go back a few years ago it was 15 million, then 5 years ago it was 20 million. So we don't know what's the correct number, but what we know is the egg is much more important than the sperm. And many studies have showcased that actually life comes from an egg and the female is much more important than the male.
Now, let's take a closer look at a complicated matter, repeated miscarriages, and Professor Fatemi is going to help us understand it better. When we talk about repeated miscarriages, we are referring to the unfortunate situation where a woman experiences several miscarriages. It's like having more than one instance of losing a pregnancy before the baby can fully develop and be born.
You know, when you have a miscarriage, it means there is something wrong. What is wrong? It's again something wrong with the egg. Now it depends when you have a miscarriage. If it's a late miscarriage, it could be an autoimmune disease, it could be a problem with the uterus. But the miscarriage, the first 2.5, 3 months, it's almost always due to genetic issues. It's almost always due to chromosomal issues of the egg. And what we start understanding that women with recurrent miscarriage, obviously there is a problem with the egg, but these women specifically should be asked if they have any cancer in the family, because cancer in the family seems also to increase the risk of miscarriage. This is linked to what we call DNA repair damage mechanism, and these women should also be cautious of possibly later to take care more of the health, because that might be a first sign that later in life something might happen. So recurrent abortion, recurrent miscarriage is extremely important. It could be a sign of the body that something might not be right. Get your child when you are young. Don't wait until you get older, and try to have a healthy lifestyle. Healthy lifestyle. Sun exposure, and have physical activity, and don't smoke and don't drink.
A big thank you to Professor Dr. Human Fatemi for sharing his valuable insights. If you found this information helpful, don't forget to like, subscribe, and hit that notification bell. Until next time, take care.